So, good morning everyone. We are the Group 1. Our topic for today is the nursing care of children with alteration health status and acute and chronic disease. Our members are Jolina Jagsa, yours truly, Elisa Dani May, Garcia Obrian, Ana Rosa May Jean, Ortalis Lucas, Roa Andrea Elijah, and Serberialo Janine. Ang agenda natin ay alteration in oxygen, reported by me. Second is the response to altered cardiac and tissue transport. I-report po ni Miss Roa and Miss Ana Rosa. Third is response to altered tissue transport, reported by Miss Serberiano. And lastly, alteration in fluid and electrolyte and acid-base balance by Miss Dagsa, Mr. Ortalis, and Miss Garcia. Okay. Bago po natin sisimulan, i-differentiate po muna natin yung sa between ng bata sa mga matanda po, yung respiratory system po nila. Ito po yung sa mga bata, oblique nasal breath, and after 6 week after delivery. Tapos po short neck, smaller and narrow airways po. Tapos more than susceptible to airway construction and the rest and distress. Yung tongue po nila is larger and approximately of the mouth. Tapos more likely to obstruct airway in unconscious children. Tapos smaller lung capacity in underdevelopment and intercostal muscle for chest and musculature. Tapos po less pulmonary serve is lung damage without children rely in diaphragm breathing. Tapos po, sa bata rin po is high risk for request failure is the diaphragm unable to contract. So, sisimulan po natin sa alteration in oxygen. Some facts lang po. In every year po, we have over 5.9 million ang mga batang namamatay sa mga kasong ito po. Ito po yung mga kasong madaling i-treat at pwede po siyang gamutin. Pero po ang 95% is those are mortalities. Pneumonia, ito yung isa sa pinaka sanhi ng pagkamatay ng mga bata sa age of 5 po nila. At least 18% din po ng mga bata ay nandoon sa age group po. Tapos po, estimated na 120 million episode of pneumonia in children under the age of 5 in 2010. Tapos po, with 14 million progressive to severe disease and 1.3 million resulting in death. Tapos po, most common death po sa alteration in oxygenation is hypoxia. Is a lack of oxygen in the blood. Tapos po, sumunod is the pneumonia compilation. Tapos, increase of death many times po ang pneumonia natin. Tapos po, hypoxemia po is estimated na affect at least 13.3% po na mga bata na may kasamang pneumonia. Tapos pangatlo po is 1.86 million ang cases ng hypoxemic pneumonia each year po ang nangyayari po sa buong bansa po. Most of the countries po yun ay kasama po doon. Tapos po further in 23% of the 5.9 million ng mga batang namamatay kada taon ay caused by the neonatal condition such as birth asphyxia, sepsis, and low birth weight of all can lead to hypoxemia. Tapos po, these factors contribute to the significant burden in hypoxemia, particularly in developing countries. Dito natin ipapakita yung 5 most causes ng oxygenation. Una is pneumonia, asthma, seborrheic proboscis, tapos po hypoxemia, tapos hypoxia po yung last po. First po is pneumonia. Pneumonia is classified etiology, viral in bacteria, fungal, and aspiration. Yung sign symptoms niya po is respiratory rhonchi, tapos rales, induce, and precaution, interact, nasal, fluttering, cough. Tapos po, yung systematic niya po is yung mataas yung lagnat, tapos po, irritable, tapos restless and lethargic pain. Tapos po, yung gastral abdomen niya po is masakit po. Tapos po sa asthma, meron po tayong long-term and short-term na asthma. Yung asthma po na sinasabi dito is yung kapag hinihingal ka tapos ina-asthma ka na agad. Ayun po yung parang long-term. Tapos po yung short-term naman po, yung kapag hindi naman siya agad-agad na napapagod ka, aasmahin ka agad. Pero po dito po is a long-term respiratory dysfunction asthma. Dito is a chronic inflammation disease of airway. Airway of inflammation, tapos bronchospasm and obstruction. Natitrigger din po yung asthma natin kapag sa may environment, kapag madumi or maalikabok po. Tapos po yung sa mga chemical kapag nasisinghot po natin yung mga bawal na chemical. Tapos po yung sa paninigarilyo, tapos nasasobrahan tayo sa pag-exercise, so sobrang hingalon tayo, aasmahin tayo. Tapos po yung sa cold, kapag inuubo po tayo. Tapos po yung sa may infection po, kapag may sakit na po yung mismong tao po. Tapos po yung sa may medication po, kapag po allergic po yung isang tao or hindi po po yung prescribed na medication po para sa kanya. Tapos po pwede rin po yun sa may foods po, tsaka po sa emotion ng isang tao. Tapos po yung sign and symptoms po ng asthma is the respiratory cough. Tapos po prolonged expiration, wheeze, tapos dimisric breath sounds and shortness of breath, tapos short and pantry paces. Tapos others po is retinless, hypertension, cyanosis, and sweating. Tapos po ang third po natin is citric fibrosis. Ang citric fibrosis po is pwede siyang hereditary disease na po yung eroxytic glands po natin. Tapos po, ang secretion of mucus niya is producing glands, especially the bronchi and pancreas. Tapos po, ito po yung mas niya po is yung lungs, lung disease po or bronchial obstruction, tsaka pulmonary hypertension. Tapos po, meron din pong overall inflammation of the lungs, repeatedly lung infection po ang citric fibrosis. Tapos po, ang sign and symptoms niya po is newborn mucus ileus po. Tapos po, tester salty when kissed. Tapos, recurrent respiratory illness and failure to gain. Tapos, weight with a good appetite. Tapos po, malas abstrophic and fast and protein stool are full, smelling. Tapos po, yung pot belly niya is wasted buttocks. Next po is the hypoxemia. Hypoxemia, ang meaning niya po is a low level of oxygen in the blood, low and oxygen saturation or content. Dito po is severe pneumonia or bronchitis po ang pwede po maging causes po niya. Tapos po, meron din po siyang served asthma. Tapos po, ang common neonatal condition niya po is like birth aphasia and in the respiratory distress syndrome, super sepsis, heart failure, cardiac arrest, trauma, carbon monoxide, poisoning, tapos obstruction and perioperative emergency. Tapos po, next is the hypoxia. Is inadequate oxygen tissue for normal cells and to organ function, and result from hypoxia. Magkoconnect po sila. Kapag po meron ka ng hypoxemia, susunod po is hypoxia. Bali po, yung hypoxia is parang, ito na po yung susunod kapag nagkaroon ka ng hypoxia. Hypoxemia. Hypoxia was many causes, from respiratory and cardiac condition of anemia. we have the symptoms and sign of hypoxia. Meron po dito different ng sign and symptoms. Restlessness, tachycardia, tachypnea, short breath, oxygen saturation level, use of accessor muscle, noise breathing, tapos flattery of nostril or forced breathing, position of the patient, tapos ability to the patient of speak and full sentence, tapos skin color, cyanosis po, tapos confused of loss and conscious or and clubbing. Tapos po, yung hypoxia din po is pwede po siyang therapy inhabited without a physician po. Ano lang po natin, tatandaan pa natin ABCD. A common vibration of airway, breathing, and circulation. Yun po yung ABCD na pwede natin gawin kapag isang tao is inatake ng hypoxia. In addition po is oxygen therapy. There are several other interventions that nurse should consider implementing to the hypoxic patient. Dito naman po is intervention to manage hypoxia. We have raise and head to the bed, tapos encourage enhancing breath and coating technique, tapos manage oxygen therapy and equipment, tapos assess the needs of respiratory medication, tapos provide oral sanction if needed, tapos provide pain relief if needed also, and consider the side effect of the pain and medication. Meron din po siyang different na pwede natin gamitin to enhance the breathing and coughing techniques ng isang patient na may hypoxia. First is the first sleep breathing. It's allowed to people to control the oxygenation and ventilation. We can use the i-exhale mo sa nose, tapos i-slower mo sa mouth yung pag i-exhale mo. Tapos incentive primary. Tapos this medication device often prescribed after the surgery ng isang pasyente po. Tapos dito is patient should attempt to hold the breath for 5 seconds as long as natotolerate niya yung mismong nasisinghot niya po. Tapos is the rest a few seconds po. To continue the enhancing breathing technique, coughing and technique, we also have coughing and deep breathing. Dito po is similar siya sa pangalawa natin na incentives primary, but hindi siya ni-require ng device. Kailangan mo lang ng take breath, deep breathe, tapos isa-slow mo lang siya, tapos yung breath mo kailangan mo ng exhale mo siya ng slowly, tapos after ng 3 to 5 minutes per hour po yung i-repeat niya po. Tapos yung huffing technique is helpful for the patient who have difficulty of coughing. Dito naman po, i-inhale mo siya, tapos i-medium size po. Tapos, kapag i-exhale mo na siya, sasabihin mo lang, ha! Ganun po. Tapos, ito po yung, maliit lang po dapat na yung pagbuka ng bunganga po natin. Tapos, vibration PEP therapy po ang last po natin. Dito po is a therapy that handed device such as flapper valves or a cappella. It is a required prescription in the collaboration with the respiratory therapies, advanced healthcare provider, and the patient should sit and deep breathe and blow into the device. Example dito po is para po siya nahahawig sa nebulizer po na isisinghot po natin siya para po gumaan po yung pakiramdam, para po makapaghinga po yung mismong tao may sakit po or may ubo, para mo ma-enhance yung breathing technique. Next po is the respiratory nursing diagnosis. Dito po is we can diagnose the patient with impaired gas exchange, ineffective airway clearance, ineffective breathing pattern, high-risk fluid volume deficit, altered tissue perfusion, tapos anxiety, active tolerance, altered growth development, knowledge deficit po yung pwede nating maging nursing diagnosis. Tapos po, we also have the pneumonia, electrobalance, hemorrhage, and hypoxia. Ang last slide po para sa alteration and oxygenation is the nursing intervention. First is the assessed respiratory status. Dito po nakapaloob yung labored breathing and swallow breathing. Tapos po, nasal fluttering head, poor air exchange, and O2 saturation. Next po is the oxygenation ventilation needs. Dito po yung parang may mga makina na po tayong ginagamit. Tapos po, incubator oxygen hood, nasal prongs, mist tent. Tapos, tracheotomy, groups, decreased respiratory efforts, infant, car seat, and knee chest position. Pwede rin po natin gamitin yung maintain airway. Held teeth, do not hyperextend neck, alterations treatment, and suction valve, BBG, trachea bronchial fluids, and IB or PO po. Next is ang pinaka mas pwede po natin gawin is itakbo talaga natin siya sa hospital po or lab. Medication, observant energy, organized care monitor, also the monitor the vital sign, and you can do the health teaching to the patient. Thank you po. For the next topics that we'll discuss with Miss Rowa and Miss Onarosa is the response to altered cardiac and tissue perfusion.
Altered cardiac, decreased cardiac output occurs if the blood pumped by the heart does not meet the metabolic demands of the body. Cardiovascular diseases such as myocardial infarction, heart failure, dysrhythmias, and other problems in fluid volume or effects of some drugs can cause a decrease in cardiac output. So the cardiac output is the amount of blood pumped by the heart per minute. It is the product of the heart rate, which is the number of beats per minute, and the stroke volume, which is the amount pumped per beat. So cardiac output is equals to heart rate times stroke volume. So the cardiac output is usually expressed in liters or minute. So this slide shows the related factors that may be related to decreased cardiac output. The signs and symptoms. A decrease in cardiac output is characterized by the following manifestations and the cardiovascular assessment. Inspection. Observe the overall appearance of the child, state of alertness, activity level. Then inspect the color, central and peripheral. So this is to know if the child have a cyanosis. So inspect their nails, hands, and feet. Next is inspect their oral mucosa. So inspection of the mucosa of the oral cavity includes observing the inside of the lips and the buccal mucosa, the tongue, under the tongue, and the hard and soft palate, the pharynx, and the salivary glands. Next is inspect the chest, size, shape, and symmetry. Chest inspection allows you to see visible external signs of respiratory function, assess the front, back, and sides of the chest for any scars, wounds, or lesions. Then inspect the respiratory rate rhythm work of breathing. So obtain the respiratory rate over a full minute. Observe the breathing pattern, including the rhythm, effort, and use of accessory muscle. Then inspect the presence of edema and inspect the clubbing. So clubbing is associated with lung cancer, lung infections, interstitial lung disease, cystic fibrosis, or cardiovascular diseases. Palpation, palpate the skin temperature trigger, and palpate the fontanelles in infants. So when assessing the fontanelles, use the flat pads of your fingers to palpate, then gently feel the surface of the head. Ensure you make note of any retraction or bulging, as the normal fontanelle feels firm and flat, not sunken or bulging. Next is palpate the peripheral pulses. So the artery is palpated and pulse counted for 30 seconds and multiplied by 2 or for a full minute if irregular. Next is palpate the blood pressure. So to know if the child is at risk for heart disease or stroke. Then next is capillary refill. The normal capillary refill is less than 2 seconds. So to check for capillary refills, press the fingers on the patient's nail bed for 5 seconds until it will turn white. Then release the pressure and count the seconds till the patient's nail bed returns pink. If it's normal, it it is 2 seconds, less than 2 seconds. Then if more than 2 seconds, then it is abnormal. Next is palpate the chest, the 3 points of maximal impulse. So palpation is performed to evaluate the characteristic of the right and left ventricular impulse. The palpation should indicate evaluation of the apical area, the parasternal area, the right and left second intercostal space, and the epigastric area.
So dito naman tayo sa causes of ineffective tissue perfusion related to hypervolemia and hypovolemia, excesses of fluid and dehydration and blood loss, low hemoglobin, insufficient blood flow, hypoventilation. So next is general nursing assessment for ineffective tissue perfusion. So number one, take a complete health history. So i-assess mo yung client for acute and chronic condition na nakaapekto sa perfusion. So kung meron ba siyang blood clots, myocardial infarctions, congestive heart failure, vascular disease, and organ failure. So lahat yun is i-consider that certain condition na nakakaapekto sa perfusion of multiple body system. The next is be aware of signs of infection. So, if di ma-identify at ma-treat agad, yung sepsis is yung extreme reaction ng body sa infection. Pwede mag-cause ng poor perfusion at dahil may poor perfusion na, magkaka-organ failure. As evidence of organ failure, yung decreased urine output and uproot mental status changes and motile skin. So, need ma-identify at maagapan yung infection. Next is review lab work and test result. Yung mga arterial blood gases, complete blood counts, yung mga electrolytes, CT scans. It should be review for signs of new or worsening perfusion issue. So, lahat ng data na nag-gather mo, yung information can also be referred to for comparison. So ngayon is magbibigay tayo ng scenario about the tissue perfusion. So sign of symptoms, so cardiopulmonary. So ano ba yung cardiopulmonary? So in a medical term, it's used to describe a range of serious disorder that affect the heart and the lungs. So subjective. So bata nga yung client natin. So, subjective naman is pwede yung magsabi yung parents or guardian. So, chest pain, pananakit ng dibdib, arrhythmia, difficulty breathing. So, yung objective naman is arrhythmia is irregular heartbeat. So, yung heartbeat ay pwede siyang mag-slowly and too quickly and too early. So, or with irregular rhythm naman. Capillary refill, 3 seconds. Altered respiratory rate. So, use of accessory muscle to breathe. It means using muscles other than those typically used for breathing to take in and expel air. The next, abnormal arterial blood gases. So it means you have a problem with your lungs or kidney or a metabolic disorder. So dito naman tayo sa nursing assessment for ineffective cardiopulmonary. So assess for sudden changes. So take note the presence of sudden chest pain, diaphoresis, and respiratory distress and hemoptysis which could signal a pulmonary embolus. Then assess the vital signs. So closely monitor the blood pressure, heart rate, respiration, and changes the cardiac rhythm. So kasi lahat ng data na yan is i-compare natin to baseline information to identify the changes in condition of our patients. The next is monitor hemoglobin level. So yung hemoglobin is a red blood cells component that carries oxygen through the body. Kung bumaba ang hemoglobin, mas kaunting oxygen ang may papalabas sa body tissue. So kailangan talaga to monitor ang hemoglobin level ng ating pasyente. Then last thing is assess the capillary fill. So yung capillary fill assess the circulation and perineal perfusion. So kung if capillary refill time is sluggish, the client may be hypovolemic at kulang ang dami ng dugo to support the circulatory system with adequate oxygenation.
Good morning, everyone. I'm Janine Servillian, and my topic today is responses to altered tissues transport. Altered tissue transport, it refers to any changes in the movement of fluids, gases, and other substances across the membranes and tissues of the body. In children, alterations in tissue transport can occur due to a variety of factors, including illness, injury, and developmental abnormalities. So, if the children experiencing illness, injury, and or developmental abnormalities, ibig sabihin nagkaroon ng alterations in tissue transport sa kanilang katawan. The responses to altered tissue transport in children can vary depending on the specific cause and location of the alteration. Some common responses may include inflammation. In response to injury or infection, the body may produce an inflammatory response. This can cause increased blood flow to the affected area, as well as the release of cytokines and other molecules that can help to fight off infection and promote healing. So, kung naaalala po ninyo, every time na nagkakaroon tayo ng sugat, ang unang nangyayari is nagdudugo siya agad and increase, ibig sabihin madami yung paglabas ng um, dugo doon sa sugat or doon sa affected area. So, kapag nagkaroon ng inflammatory, nagkakaroon siya ng redness, nagsiswelling din po siya. So, ganun po nangyayari ang inflammation. So, after that, nagre-release ito ng cytokines and other molecules para naman mag-fight doon sa infection at mag-promote ng healing or gumaling din yung sugat. Next is the edema. It refers to the buildup of excess fluid in the tissues, often as a result of inflammation or injury. This can cause swelling, pain, and reduced function in the affected area. So, dito naman po, nagbi-build up yung excess fluid sa tissues. So, kung may nakikita kayo na yung mga namamanas, yung kanilang binte, ibig sabihin nun, nagkakaroon ng build up fluid sa tissue. Kaya nare-reduce din yung function nun sa affected area. Next is the hypoxia. It occurs when body's tissues are not receiving enough oxygen. This can be caused by a variety of factors, including respiratory problems, anemia, or circulatory issues. In children, hypoxia can lead to developmental delays and other long-term health problems. So dahil yung hypoxia is low levels of oxygen in your body tissues, nagkakaroon siya, kakaroon siya ng like confusion, restlessness, difficulty of breathing, rapid heart rate, and bluish skin. So, ganun yung nagto-cause or yun yung mga cause ng hypoxia. And yung hypoxia, it can lead also it can be a life-threatening also. Next is the impaired organ function. Alterations in the tissue transport can also affect the function of specific organs or systems in the body. For example, impaired transport of glucose or insulin can lead to diabetes, while impaired transport or electrolytes can lead to imbalances that affect the heart, brain, and other organs. So, katulad nga dun sa example na binigay dito na kapag nagkaroon ng impaired transport sa glucose or insulin, magli-lead siya sa diabetes. So we have this scenario about the responses to altered tissues transport for children. So Samantha is a 5-year-old girl who has been experiencing swelling in her left leg. Her parents noticed that her leg had become noticeably larger than her right leg and was slightly discolored. They took her to the pediatrician, who referred them to specialists for further evaluation. The specialist determined that Samantha was experiencing lymphedema, a condition that occurs when the lymphatic system fails to function properly, resulting in the buildup of fluid in the tissue. So, katulad nga dun sa nangyayari kapag nagkakaroon ng edema. So, here is the nursing intervention. First is the educating the child and parents. The nurse can provide education on the nature of lymphedema, including its causes, signs and symptoms, and treatment options. They can also teach Samantha and her parents about the importance of good skin care, exercise, and compression therapy. Next is monitoring for complications. The nurse should monitor Samantha for any signs of infection, such as redness, warmth, or swelling of the affected limb. They can also monitor for any other complications, such as reduced mobility or skin breakdown. Assisting with treatments, the nurse can assist with the administration of manual lymphatic drainage, compression bandages or garments, and exercise programs. They can also teach Samantha and her parents how to perform these treatments at home. Next is providing emotional support. Living with a chronic condition can be stressful, especially for a young child. The nurse can provide emotional support to Samantha and her family, including encouragement, reassurance, and a listening ear. And last is coordinating care. The nurse can work with other members of the healthcare team, such as the specialist and physical therapist, to ensure that Samantha receives comprehensive and coordinated care. They can also help to schedule follow-up appointments and communicate with other healthcare providers as needed.
So next is alteration in fluid and acid and electrolyte imbalance. So what are alteration in fluid, electrolyte, and acid balance? This refers to changes in the levels of distribution of fluids, electrolytes, and acids inside the body. These changes can occur due to various factors such as illness, injury, medication, or lifestyle choices. Fluid balance refers to the amount of water in the body and the distribution of that water between the compartments of the body. Alteration in fluid balance can result in dehydration or overhydration. Electrolyte balance refers to the levels of ion such as sodium, potassium chloride, calcium, magnesium, etc. inside the body. So alteration in electrolyte balance can cause electrolyte imbalance such as hypo and hypernatremia, which refers to low sodium and high sodium, hypo and hyperkalemia, which refers to low potassium and high potassium. Acid-base balance refers to the pH balance in the body, which is maintained by the balance of acids and bases. Alterations in acid-base balance can lead to acidosis, which is increasing acidity in the blood, or alkalosis, which is decreased acidity in the blood. This alteration can have significant effects on the body's function and can lead to a wide variety range of symptoms and health problems. It is important to maintain a proper balance of fluids, electrolytes, and acids in the body to support optimal and health well-being.
Physiology of the fluid and acid balance. Fluid and acid balance are essential the proper functioning of the human body. The body fluid balance is maintained by regulating amount of the water and electrolytes in the body, while the acid balance are refers regulations of the pH of the body fluids. Fluid balance, the human body is made of approximately 60% water, and the maintaining fluid balance is crucial of the proper physiological function. Acid-base balance or pH of the body fluids is tightly regulating to maintain proper physiological function. The pH is a measure of the acidity of the solutions and determined by the concentration of the nitrogen in the solution. In the summary, fluid and acid balance are the essential physiological functions that are regulated through the actions and hormones in the lungs and kidneys, maintaining the proper fluid and acid balance. Base balance is crucial for the maintaining overall health and preventing the development of previous medical condition. The terms used describe the compartmentalized body fluids, or we have three: intracellular fluid within the cell. Second is the extracellular fluid within the blood vessels, and the lastly is the interstitial fluid within between cells fluid that the surround cells. Mechanism to restore balance. Mechanism restore balance requires the combination of self-awareness, problem-solving skills, and willingness to make changes by taking steps and identify the addresses imbalance in our lives. We can improve our well-being and create more harmonious existence. We have the kidney conserves water, regulates and electrolytes. Extractions to YR kidneys immature is able to conserve of excrete water and solute effectively, and greater risk for the acid-base imbalance, and lastly in will use SG. This is the mechanism to restore balance. Fluid volume imbalance refers to abnormal amounts of fluid in the body, which can result from the variety of causes. Their imbalance can have serious consequences for the body overall health and functioning. There are two main types of fluid volume imbalance. We have dehydrations and overdehydrations. Dehydration occurs when the body loses more fluid than it takes in, leading to deficit of the body water. Overdehydrations on the other hand occurs when the body takes in the more fluid than it can excrete, leading to excess of the body water. Fluid volumes imbalance causes by the vomiting, diarrhea, hemorrhage, burns, NG's suctioning, and drainage loss and adrenal insufficiency. You can see we have the five, the fluid volume imbalance causes. Yung manifesting by loss, ito yung pwede ka mamayat, yung balat mo, and nagkakaroon ka, yung vital signs mo nag-iiba, and marami pang iba. The second is dehydrations that not corrected will lead in hypovolemic shock or pwede mong ikamatay, and fluid overload excess, ECF fluid and excess intestine fluid volume and with the edema. And pang-apat, ito yung nagkakos ng mga sobrang overload fluid na sa katawan mo. And the 5 is manifested by weight gain, yung pamamayat, and yung face mo, yung parang parang yung cheek mo parang nakadikit na dun sa pinakabuto, parang ganon. And extreme enlarged the liver, pwedeng lumaki yung liver mo. Mas lumaki pa yung liver mo. The body fluid distributions. The human body is made of the approximately 60% water, discuss ko na yan kanina, which is distributed throughout various compartments within the body. This is compartments are known as a body fluid. Compartments can be divided into two main types. Kanina yung na-explain ko. We have the intercellular fluid or ICF. This is a fluid that inside the cells make up the approximately 2/3 the body total water content. The lastly is the extracellular fluid or ECF. This is the fluid that outside the cells and makes up the approximately 1/3 the body in total water content. This is the further divide into the components. Yung plasma, this is the fluid component of the blood and makes up approximately 55% of the blood volume. And the interstitial fluid, discuss ko na rin yun. This is the fluid surrounds the cells and found of the spaces between the cells in the tissues. The movement of the fluid between the compartments is regulated with the various mechanisms such as osmosis, diffusions, and active transport. Electrolytes are the ions that are dissolved in the solution and able to conduct electricity. They are important for many biological processes in the body, as the help to maintain proper fluid balance, transmit nerve impulses, and support muscle functions. Some common electrolytes include the sodium, potassium, chloride, calcium, and magnesium. Their electrolytes are typically found in body fluids such as blood, urine, and sweat. Movement of the body fluids is the crucial of the proper functioning of the human body. There are the several types of the body fluids, including the blood interstitial fluid, cerebrospinal fluid, and the synovial fluid, and each of these fluids several different purpose, and the movement is fluid achieved through various mechanisms such as diffusions, osmosis, filtration, and active transport. Regulators of fluid balance. Body fluids are mainly water and electrolytes, and are the three main organs that regulates fluid balance, or we have the brain, adrenal glands, and lastly is the kidneys. Electrolytes disturbances. Electrolytes are charged particles that are essential for many physiological processes in the human body, including the nerve and muscle functions, fluid balance, and acid-base balance. Electrolyte disturbances occurs when the levels of these charged particles in the body become the imbalance, which can lead to a range of the symptoms and health problems. We have two sodiums. We have the hyperthermia, and the lastly is the hypernatremia. The first is hypernatremia. This occurs when the level of the sodium in the blood is too low, which can lead to symptoms such as vomiting, headache, confusion, seizures, and coma. Hypernatremia. This occurs when the levels of sodium in blood is too high, which can lead to symptoms such as thirsty, dry mouth, restlessness, confusion, seizures, and coma. Lastly, we have the potassium hypokalemia. This occurs when the levels of potassium in the blood is too low, which can lead to symptoms such as weakness, fatigue, muscle cramps, constipations, and abnormal heart.
So good morning, I am Aubrey Garcia and I'll be discussing acid-base balance. Acid-base balance refers to the homeostasis of the hydrogen ion concentration in body fluids. So anong meaning nun? Acid-base balance, iyon yung state ng pagkakaroon ng right amount of acid and base in the blood and other body fluids like interstitial fluids, saliva, and gastric juices. Interstitial fluid is a fluid found around the cell. Ito yung tumutulong para makapagdala ng oxygen and nutrients sa cells and para ma-remove yung waste product from them. So, sa acid-base balance, bakit kailangan i-maintain yung concentration of hydrogen ion in body fluids? Kasi hydrogen ions are maintained to keep pH ranges between narrow limits. It is a necessity para sa normal bodily functions like digestion. Kapag kasi yung pH natin is too acidic, the cells lining sa stomach, small intestine, as well as the cells sa pancreas, which is responsible sa pagpaproduce at pagre-release ng digestive enzymes, is hindi makakapag-function ng maayos na pwedeng mag-result in indigestion, gas, bloating, and abdominal cramping. Kapag naman yung pH level natin is too basic, pwedeng makaramdam ng muscle spasms, nausea, vomiting, and numbness sa face, sa feet, and sa hands. So, our kidneys and lungs, ito yung mga organs na nag-work to maintain the acid-base balance kasi even slight variations from the normal range is pwede magkaroon ng significant effects on our vital organs. Sabi rin dito, acid is a substance na nagdodonate ng hydrogen ions while yung base naman yung substance na nag-accept ng hydrogen ion. Dito naman sa regulators ng acid-base balance, may tatlong i-discuss. The pH blood is controlled by three systems: chemical buffering, respiratory function, and renal function. Una, buffer system respiratory. Buffer means to moderate the impact of. Yung respiratory system natin, minimaintain ito yung pH ng blood through bicarbonate buffer system. Kapag yung pH ng blood ay bumababa, yung concentration ng hydrogen ions ay tumataas. Dahil dito, nagsishift yung equilibrium sa left, in which mas nagpaproduce ng carbon dioxide. Additionally, kapag nag-increase ang hydrogen ion sa blood, nagsisend ng signal sa brain na pataasin yung respiratory rate. At kapag nag-increase yung respiratory rate, syempre mas maraming carbon dioxide yung na-exhale, kaya mas maraming nakikreate ng carbon dioxide yung equilibrium and removal of hydrogen ion sa blood na nag-increase naman ng blood pH. Tandaan, ang blood natin should always have balanced acidic and basic substance to function properly. Not too acidic, not too basic, because both of them have underlying conditions. Acidosis ang tawag sa condition kapag ang acid sa blood is too high, and alkalosis naman ang tawag kapag the blood is too alkaline. Meron ding respiratory acidosis and alkalosis na tinatawag dahil naman to sa problem sa lungs. Then metabolic acidosis and alkalosis naman kapag problem sa kidneys. Mamaya we will dive deeper sa mga condition na to, particularly kapag sa mga child nangyayari. For the regulations of acid-base balance, ang normal and acid-base balance
ay namaintain ng kidneys and lungs. Carbon dioxide, a byproduct of normal metabolism, is a weak acid. And by excreting, the lungs are able to prevent an increase in the partial pressure of carbon dioxide na pinaproduce ng body. For the renal control of hydrogen ion concentration, may dalawang main ways ang kidneys para ma-maintain ang acid-base balance. First, their cells reabsorb bicarbonate from urine back to the blood, and then magsisecrete ito ng hydrogen ion sa urine. By adjusting the amounts reabsorbed and secreted, they balance the bloodstream's pH. Now, for the acid-base disturbance in children, first is the respiratory acidosis. Respiratory acidosis, hindi to specific disease, may abnormality lang na resulta ng imbalance between the production ng carbon dioxide sa katawan at kung paano ito in-excrete ng lungs. This can be caused by factors that decrease a child's respiratory effort, usually yung slow or shallow breathing, will accumulate and build up carbon dioxide. When combined with water, this forms what we call carbonic acids and eventually naglilid sa acidosis. And then yung mga bata na may respiratory acidosis, madalas confused, lethargic, and disoriented. So ano nga ba yung mga causes ng respiratory acidosis? Inadequate ventilation, nagbe-build up yung carbon dioxide and kaunti lang yung oxygen, which can cause shortness of breath, pagsakit ng ulo, at saka fatigue. And then increased partial carbon dioxide or yung hypercapnia na tinatawag when there's too much oxygen sa blood. And then CNS depression, nabanggit nga kanina na yung batang may respiratory acidosis is usually confused and disoriented or poor yung concentration nila. And then chronic respiratory disease like COPD, asthma, and even scoliosis, since naapektuhan nito yung chest, may discomfort ka na. Inadequate mechanical ventilation, atelectasis, ito yung may fluid between sa lungs and sa chest wall. Sedative overdose, sleep apnea, which is nangyayari kapag yung smooth muscle na nagsusupport ng soft tissues natin sa throat is nag-relax, nagnanarrow yung airway, or nagko-close kaya momentarily nakakat off yung breathing. One of the cause naman kung bakit nangyayari to is because of obesity na nakalagay sa chronic acidosis. And then, neuromuscular disease, pulmonary edema, ito yung may normal buildup ng fluid sa lungs. Aspiration of foreign objects, nangyayari ito kapag accidentally may na-inhale na object yung bata and na-reach yung respiratory tract. And then, acute respiratory distress. And ito naman yung mga causes kapag nag-occur na yung chronic respiratory acidosis, chronic emphysema, bronchitis, obstructive sleep apnea, and obesity. So dito naman sa manifestation, the following would usually manifest in a child with respiratory acidosis: dyspnea, tachycardia, cyanosis, increase yung intracranial pressure, may CNS depression, cerebrovascular vasodilation, increase in cerebral blood flow, ventricular fibrillation, increased use of accessory muscle, sudden hypercapnia, increase yung pulse, and then as well as blood pressure, may mental cloudiness, and nararamdaman nila na full yung parang yung ulo nila is parang nangangapal. And then dilated yung conjunctival blood vessels and may hyperkalemia. So, para naman sa management ng respiratory acidosis ng mga bata, nagpo-focus tayo sa pag-i-improve ng ventilation nila. So, first, assist the patients in a semi-fowler's position. This position facilitates chest expansion. And then, pulmonary hygiene is initiated. If possible, dapat free yung bata sa any pulmonary congestion. And then, very important yung hydration. Average 3 liters, advisable yun na i-facilitate para sa mucus drainage. And then, oxygen therapy is also initiated. Proper use and monitoring of mechanical ventilation And then medications such as bronchodilators are indicated as given and disordered. This will reduce bronchial spasms. And if may infection, antibiotics are given as ordered. And if pulmonary naman, anticoagulants and thrombolytics are administered as ordered. Sa respiratory alkalosis naman in pediatrics, ito naman yung condition wherein mababa yung carbon dioxide level. And frequently pain, anxiety, infection, meningitis, mechanical overventilation, hypoxemia, salicylate poisoning or intoxication, inappropriate ventilator setting, and other conditions na nagkakos ng hyperventilation sa bata, which is yung nagbo-blow up sila ng too much carbon dioxide and nagkakos yun ng decrease sa plasma carbonic acid concentration, which is nagli-lead sa respiratory alkalosis. So, sa chronic respiratory alkalosis, on the other hand, ito yung result ng hypocapnia, chronic renal insufficiency, and cerebral tumors. It is a condition where arterial pH is greater than 7.45 and the partial carbon dioxide is less than 38 mmHg. The child will eventually manifest numbness, faintness, tingling sensation, or So, sa causes naman ng respiratory alkalosis, the following is a summary of the predisposing factors ng respiratory alkalosis: alveolar hyperventilation, and then decrease naman yung partial carbon dioxide levels, overzealous mechanical ventilation, anxiety, heart failure, sepsis, hepatic failure, may fever, may hypermetabolic states, and salicylate poisoning. Ayan, ito naman yung mga manifestation na makikita sa mga batang may... So, for the manifestation, ito yung mga signs and symptoms na makikita sa mga batang may respiratory alkalosis, tachypnea, diaphoresis, may numbness, and may tingling sa toes nila, sa fingers, syncope, or yung other terms sa faintness and passing out, and then dizziness, lightheadedness, and inability to concentrate, tinnitus, loss of consciousness, tachycardia, and arterial dysrhythmias. So, para naman sa management ng respiratory alkalosis, yung healthcare team, kailangan nilang i-treat yung underlying cause. If yung bata is nasa anxious stage, kailangan natin i-instruct na huminga sila ng mabagal in order for the carbon dioxide to accumulate. And tuturuan natin yung bata na huminga sa closed system through a paper bag para ma-preserve yung carbon dioxide niya inhale. Para naman sa hyperventilation ng bata, magpe-prescribe ng sedative and as ordered yon para ma-relieve yung anxiety and overventilation and thus decrease the acidosis. And mag-administer ng sodium chloride and potassium chloride as ordered, as well as fluid volume replacement is initiated as indicated. And yung seizure, i-observe din natin yung seizure precautions. And closely monitored yung intake and output ng bata. And then yung electrolyte level, yung monitor din. So, para naman sa metabolic acidosis in pediatrics, clinical alteration to wherein decrease yung pH and mataas naman yung hydrogen ion concentration and low yung plasma bicarbonate concentration. And then, precipitated to by vomiting, gastric junction, diarrhea, or diabetic ketoacidosis. Metabolic acidosis, nangyayari to either when the body produces too much acid or when the kidneys are unable to remove it properly. Para naman sa causes ng metabolic acidosis, may variety ito ng causes, but most frequently is predisposed by the following condition. So, increase yung body acid such as acetoacetic, acetone, ganon. And decrease yung bicarbonates, shock, and nangyayari dito sa kapag tumas yung starvation, laging gutom, laging nalilipasan ng gutom. And then, mataas din yung acid intake. And then, alcohol ketoacidosis, may renal failure, and diabetic ketoacidosis. So, para naman sa manifestation ng metabolic acidosis, yung mga bata na may ganito, usually, lethargic sila, quite confused, and mataas yung pulse rate nila. Tapos, pero, depende pa rin sa severity ng acidosis yung manifestation. So, here are the signs and symptoms na pwede natin makita sa kanila. Headache, confusion, drowsiness, lethargy, and warm and dry skin. Nangyayari naman to kapag severe na yung acidosis. Nausea, vomiting, peripheral vasodilation, decreased cardiac output, as well as blood pressure. Cold and clammy skin. Nangyayari naman to kapag mild yung acidosis. Tachycardia, dysrhythmias, shock, increased and rapid respiration, and deep respiration. Para naman sa management ng metabolic acidosis, same lang siya ng bata at saka ng adult kapag kinokorek natin yung metabolic defect. So, oxygen administration, and i-correct yung DKA with insulin or glucose. And syempre, i-monitor yung vital signs. Tapos, kapag naman ang cause is too much consumption of chloride, ang probable treatment nito is mag-focus sa eliminating ng source. And then, i-monitor din yung potassium level. Closely monitored yon. And, i-correct yun after i-intervene ng acidosis. If the bicarbonate levels reach less than 12, alkalizing agents are given as ordered. If the pH is less than 7.1 and the bicarbonate level is less than 10, bicarbonate is administered as ordered. So for the last, alkalosis and acidosis disturbance, metabolic alkalosis in pediatrics, ito yung condition when there is a bicarbonate retention and hydrogen ion loss. It is clinical characterized by high pH, mataas yung pH niya, and decreased naman yung hydrogen ion concentration, and mataas naman yung bicarbonate concentration in the plasma. Usually, nangyayari to kapag yung bata may prolonged vomiting, have ingested large amounts of bicarbonate antacids, and nagkaroon siya ng massive blood transfusion, and nasogastric fluid loss, loss of hydrogen and chloride ions, and yung mga bata na naka-experience ng metabolic alkalosis, sila yung makikita mga nanghihina, dizzy, and typically, nakakaranas sila ng muscle cramps. Para naman sa mga causes ng metabolic alkalosis, meron decrease in body acids, chronic ingestion of milk and calcium carbonate, increase yung bicarbonates, prolonged nasogastric suctioning, yung paggamit ng diuretics or diuretic therapy, thiazide, furosemide, which is nagpo-promote ng excretion of potassium. And then ito nga, nagkaroon na ng hypokalemia and overconsumption of fused or antacids, pyloric stenosis or gastric fluid loss, and excessive adenocorticoid hormones, hyperaldosteronism, Cushing syndrome, and cystic fibrosis. So, sa manifestation naman ng children with metabolic alkalosis, usually ito yung mga signs and symptoms. So, meron tingling sa fingers, hypertonic muscles or muscle cramps, depressed respiratory functions, dizziness, slow yung respiration, shallow respiration, disoriented sila, and then hypokalemia, mababa yung potassium, ventricular disturbance, decreased gastric motility, seizures, may tremors, muscle twitching, atrial tachycardia, paralytic ileus, premature ventricular contractions, U waves on the ECG. So, para naman sa management, gaya ng ibang imbalances, ang treatment nito is nakafocus ang aim natin is ma-reverse yung disorder. So, children with metabolic alkalosis, binibigyan sila ng adequate chloride para sa support ng kidney. Absorb sodium with chloride which allows the excretion of excess bicarbonates in the body. And then, i-stabilize naman yung body fluid and i-restore. By administering sodium chloride fluids, alkalosis is prevented. Prolonged volume depletion causes alkalosis. So, para naman sa mga batang may heart failure, which is hindi nila natotolerate yung rapid volume expansion, carbonic anhydrase inhibitors are used to treat the alkalosis. In hypokalemic patients naman, potassium chloride is indicated to replace both the lost potassium and chloride in the body. And then, i-monitor din yung child's input and output, which is significantly helpful para sa pagmamanage ng alkalosis. So, para naman sa metabolic alkalosis caused by gastric sanctioning, histamine 2 receptor antagonists are given as ordered. This drug reduces the production of gastric, thus decreasing the alkalosis.
Symptoms. So, fluid, electrolyte, and acid-base balance are important aspects of maintaining the body's normal physiological functions. Alteration in these balances can lead to a wide range of symptoms that can be potentially life-threatening. Some common symptoms of alteration in fluid, electrolyte, and acid-base balance includes dehydration, edema, hypovolemia, hyponatremia, hypernatremia, hypo and hyperkalemia, acidosis, and alkalosis. So, dehydration, if you feel dehydration, you will feel thirsty, you have a dry mouth, you will feel the fatigue, decreasing urine output, and you will see the color of the urine is dark yellow. All of these are symptoms of dehydration. It occurs when the body loses too much water and electrolytes such as sodium, potassium, and chloride. Next is edema. In edema, you will experience the swelling in your legs, your feet, your ankles, or hands, and this can be sign of excess fluid in the body, which may occur due to heart, liver, or kidney problems. Next is hypovolemia. This means you have a reduced blood volume that can cause symptoms such as low blood pressure, rapid heartbeat, dizziness, and fatigue. This condition can be caused by dehydration, hemorrhage, or severe burns. Next is hyponatremia. Hyponatremia means you have a low sodium levels that can cause symptoms such as headache, nausea, vomiting, seizures, confusion, and coma. This condition can be caused by excessive sweating, diarrhea, or kidney problems. Next is hypernatremia. In hypernatremia, you have high sodium level, and that can cause symptoms such as thirst, dry mouth, restlessness, muscle weakness, and seizures. This condition can be caused by excessive sodium intake, dehydration, or kidney problems. Next is hypokalemia. In hypokalemia, you have a low potassium level, and this can cause symptoms such as weakness, fatigue, muscle cramps, constipation, and irregular heartbeat. This condition can be caused by excessive sweating, vomiting, or the use of certain medications. Next is hyperkalemia. In hyperkalemia, you have high potassium levels that can cause symptoms such as muscle weakness, numbness, tingling, nausea, and irregular heartbeat. This condition can be caused by kidney failure, certain medications, or a diet in high potassium. Next is acidosis. Acidosis means you have a low blood pH that can cause symptoms such as fatigue, confusion, shortness of breath, and coma. This condition can be caused by diabetes, kidney disease, or lung disease. Next is alkosis. Alkosis means you have a high blood pH that can cause symptoms such as muscle twitching, numbness, tingling, and confusion. This condition can be caused by excessive vomiting, the use of certain medication, or respiratory alkalosis. Disorder. Several disorders can cause alteration in fluid, electrolytes, and acid-base balance. Some of the most common ones include dehydration, congestive heart failure, kidney disease, diabetic ketoacidosis, respiratory acidosis, hypokalemia, hypernatremia, hyponatremia, and hyperkalemia. First is dehydration. This occurs when the body loses more fluid than it takes in. It can be caused by excessive sweating, diarrhea, vomiting, fever, or not drinking enough fluids. Next is congestive heart failure. This condition occurs when the heart is unable to pump blood effectively, leading to fluid accumulation in the lungs and other parts of the body. Next is kidney disease. The kidney plays a vital role in maintaining fluid, electrolyte, and acid-base balance. Kidney disease can lead to electrolyte imbalance, fluid retention, and acidosis. Diabetic ketoacidosis is a serious complication of diabetes that occurs when the body produces high levels of blood acids called ketones. This can lead to electrolyte imbalance and acidosis. Respiratory acidosis. Now, this occurs when the lungs cannot remove enough carbon dioxide from the body, leading to an increase in blood acidity. Next is hypokalemia. This is a condition characterized by low potassium levels in the blood, and it can be caused by a certain medication, kidney disease, or excessive sweating. Hypernatremia. Now, this occurs when there is too much sodium in the blood, and it can be caused by dehydration, excessive sodium intake, or kidney problems. Next is hyponatremia. This is a condition characterized by low sodium levels in the blood, and it can be caused by excessive sweating, diarrhea, or kidney problems. Next is hyperkalemia. Now, this occurs when there is too much potassium in the blood, and it can be caused by kidney disease, certain medication, or a diet high in potassium.
We have here a scenario: a 10-year-old boy na na-admit sa hospital with symptoms of dehydration, including dry mouth, decreased urination, and fatigue. And then in-assess ng healthcare team yung body fluid ng bata and electrolyte status, ay nakita nila na may low level of sodium sa blood, which is hyponatremia, and elevated yung level ng bicarbonate in his blood, which is metabolic alkalosis. And then nag-initiate yung healthcare team ng treatment by administering IV fluids containing electrolytes, specifically sodium, to correct the boy's hyponatremia. And also, minonitor nila yung fluid intake and output ng bata closely to ensure that he is receiving adequate hydration and electrolyte balance. Additionally, they administer medication to correct metabolic alkalosis by balancing the pH of the boy's blood. And then nag-educate din sila sa bata and sa family about the importance of maintaining adequate liquid and electrolyte balance, as well as the signs and symptoms ng dehydration and electrolyte imbalances. They provide the family with guidelines for appropriate fluid and electrolyte intake, and encourage them to monitor the boy's hydration status regularly. Throughout the boy's hospitalization, the healthcare team continues to monitor his fluid and electrolyte status and adjust his treatment as needed to maintain optimal balance. Once the boy's electrolyte imbalances have been corrected, he is discharged from the hospital with instructions for follow-up care and monitoring to ensure that his fluid and electrolyte balance remains stable.
Now for the intervention, the healthcare team should monitor the vital signs of the patient because having dehydration or undergoing dehydration and electrolyte imbalance can affect the respiratory rate, the blood pressure, the heart rate of the patient. So they should monitor that. Next, they should also assess the patient's urine output so they know that the boy is being adequately hydrated. Next is they should also monitor his mental state as well because undergoing a electrolyte imbalance can cause confusion or seizures. So they should monitor the mental state of the patient as well. Now, lastly, for the treatment, um, the treatment for alteration in fluid, electrolyte, and acid-base balance depends on the specific type of severity of the imbalance. However, some general treatment approaches include fluid replacement, electrolyte replacement, acid-base balance correction, medication, treatment of underlying conditions, and monitoring. For fluid replacements, if the patient is dehydrated or has an electrolyte imbalance, they should replace the fluid that has lost and or administer uh, depends on the severity of underlying cause of the imbalance. Next is electrolyte imbalance. Uh, in replacing in electrolyte replacement, they should replace the lost electrolytes based on the imbalance that they need to replace. For example, if the patient has a low sodium level, they should administer a fluid containing sodium. Next is acid-base balance correction. So depending on the specific acid-base imbalance, different treatments may require. For example, acidosis bicarbonate may be administered. For respiratory acidosis, the underlying respiratory condition may need to be treated, such as with supplemental oxygen. In medication can be used to help correct the electrolyte imbalance or acid-base disorders. For example, diuretics may be used to remove excess fluid, or potassium supplements may be given to correct hypokalemia. Next, treatment of underlying conditions. The underlying condition causing the imbalance may need to be treated. For example, if the patient has kidney failure causing electrolyte imbalance, treatments may involve dialysis to remove the excess fluid and electrolytes. And lastly, monitoring. Monitoring the patient's fluid, electrolyte, and acid-base imbalance status should be monitored closely to ensure that the treatment is effective and to adjust the treatment as necessary.